In the realm of bipolar disorder treatment, two medications have emerged as front-runners: aripiprazole and risperidone. But which one is the best choice for those seeking relief from this complex mental health condition? In this video, we will delve into the key differences and similarities between aripiprazole and risperidone, providing the perspective and insights needed to make an informed decision. Aripiprazole, a widely prescribed atypical antipsychotic, has gained popularity due to its unique mechanism of action. Known by its brand name Abilify, it works by partially activating dopamine receptors in the brain, helping to regulate mood and minimize symptoms of bipolar disorder. On the other hand, risperidone, also categorized as an atypical antipsychotic, exerts its effects by blocking certain dopamine and serotonin receptors. Its brand name is Risperidone. Considering the various factors at play, including efficacy, side effects, and individual patient characteristics, determining the right treatment approach can be challenging. By exploring the perspectives on aripiprazole and risperidone, this video aims to provide clarity and valuable insights to those navigating the labyrinth of bipolar disorder medications. Whether you are a healthcare provider or an individual seeking treatment options, this video will equip you with the knowledge to make an informed decision. Understanding bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme shifts in mood, energy levels, and activity levels. Individuals with bipolar disorder experience episodes of mania, characterized by elevated mood, increased energy, and impulsive behavior, as well as episodes of depression, characterized by low mood, decreased energy, and feelings of hopelessness. These mood swings can significantly impact an individual's daily functioning and quality of life. It is estimated that approximately 2.8% of the adult population in the United States has bipolar disorder, making it a relatively common mental health condition. The exact cause of bipolar disorder is still unknown, but it is believed to be a combination of genetic, environmental, and neurochemical factors. Effective treatment of bipolar disorder typically involves a multimodal approach, including medication, therapy, and lifestyle modifications. Treatment options for bipolar disorder. There are several treatment options available for individuals with bipolar disorder. Medications, such as aripiprazole and risperidone, play a crucial role in managing symptoms and stabilizing mood. These medications are often prescribed as part of a comprehensive treatment plan, which may also include psychotherapy, support groups, and lifestyle changes. Aripiprazole and risperidone fall under the category of atypical antipsychotics, which are commonly used in the treatment of bipolar disorder. Atypical antipsychotics work by modulating the levels of neurotransmitters in the brain, specifically dopamine and serotonin, which are believed to be imbalanced in individuals with bipolar disorder. By restoring the balance of these neurotransmitters, these medications can help alleviate symptoms and prevent relapses. Overview of aripiprazole and risperidone. Aripiprazole, sold under the brand name Abilify, is an atypical antipsychotic that was approved by the U.S. Food and Drug Administration, FDA, in 2002 for the treatment of bipolar disorder. It is also approved for the treatment of schizophrenia, major depressive disorder, and irritability associated with autism spectrum disorder. Aripiprazole is available in different formulations, including oral tablets, orally disintegrating tablets, and extended-release injections. Risperidone, marketed as Risperidone, is another atypical antipsychotic that was approved by the FDA in 1993 for the treatment of schizophrenia. It is also approved for the treatment of bipolar disorder, irritability associated with autism spectrum disorder, and certain behavioral symptoms in individuals with dementia. Risperidone is available in oral tablets, orally disintegrating tablets, and long-acting injection formulations. Efficacy of aripiprazole in treating bipolar disorder. Aripiprazole has shown efficacy in the treatment of bipolar disorder, particularly in reducing manic symptoms. Several clinical trials have demonstrated its ability to stabilize mood and prevent relapses in individuals with bipolar disorder. In a randomized, double-blind study published in the Journal of Clinical Psychiatry, aripiprazole was found to be more effective than placebo in reducing manic symptoms and improving overall functioning in patients with bipolar I disorder. Another study published in the Journal of Affective Disorders compared the efficacy of aripiprazole and lithium, a commonly prescribed mood stabilizer, in the treatment of bipolar disorder. The results showed that aripiprazole was as effective as lithium in reducing manic symptoms and preventing relapses, with fewer side effects reported in the aripiprazole group. Efficacy of risperidone in treating bipolar disorder. Risperidone has also demonstrated efficacy in the treatment of bipolar disorder, particularly in reducing both manic and depressive symptoms. A systematic review and meta-analysis published in the Journal of Clinical Psychopharmacology examined the efficacy of risperidone in the treatment of bipolar disorder. The analysis included several randomized controlled trials and found that risperidone was effective in reducing manic symptoms and improving overall functioning in individuals with bipolar disorder. A study published in the Journal of Clinical Psychiatry compared the efficacy of risperidone and divalproex, another commonly prescribed mood stabilizer, in the treatment of acute mania in bipolar disorder. The results showed that both risperidone and divalproex were effective in reducing manic symptoms, with no significant differences in efficacy between the two medications. Side effects of aripiprazole. Like any medication, aripiprazole is associated with potential side effects. Common side effects of aripiprazole include nausea, vomiting, restlessness, dizziness, and headache. Some individuals may also experience weight gain, increased blood sugar levels, and changes in cholesterol levels. It is important to discuss any concerns or side effects with a healthcare provider to determine the best course of action. Rare but serious side effects of aripiprazole include tardive dyskinesia, a condition characterized by involuntary movements of the face and body, and neuroleptic malignant syndrome, a potentially life-threatening reaction to antipsychotic medications. These side effects are rare but require immediate medical attention if they occur. Side effects of risperidone. Risperidone is also associated with potential side effects. Common side effects of risperidone include drowsiness, dizziness, constipation, and dry mouth. Some individuals may also experience weight gain, increased blood sugar levels, and changes in cholesterol levels. It is important to discuss any concerns or side effects with a healthcare provider to determine the best course of action. Rare but serious side effects of risperidone include tardive dyskinesia and neuroleptic malignant syndrome, similar to aripiprazole. These side effects are rare but require immediate medical attention if they occur. Factors to consider when choosing between aripiprazole and risperidone. When choosing between aripiprazole and risperidone for the treatment of bipolar disorder, several factors should be considered. These factors include the individual's specific symptoms, treatment goals, previous medication history, and potential side effects. It is important to work closely with a healthcare provider to determine the most appropriate treatment approach based on these factors. Individuals with a history of certain medical conditions, such as diabetes or cardiovascular disease, may have specific considerations when choosing between aripiprazole and risperidone. It is crucial to disclose any medical conditions or medications to the healthcare provider to ensure the safety and efficacy of the chosen medication. Personal experiences and testimonials. Personal experiences and testimonials can provide valuable insights into the effectiveness and tolerability of medications like aripiprazole and risperidone. It is important to remember that everyone's experience with these medications may differ, and what works for one person may not work for another. Personal experiences should be considered in conjunction with medical advice and professional guidance. Online forums and support groups can be a valuable resource for individuals seeking personal experiences and testimonials from others who have used aripiprazole or risperidone in the treatment of bipolar disorder. It is important to approach these sources with caution, as anecdotal evidence may not always be reliable or representative of the general population. Conclusion and final thoughts. In conclusion, aripiprazole and risperidone are both effective treatment options for bipolar disorder. They belong to the class of atypical antipsychotics and have demonstrated efficacy in managing manic and depressive symptoms associated with bipolar disorder. The choice between aripiprazole and risperidone should be based on individual factors such as symptoms, treatment goals, previous medication history, and potential side effects. It is crucial to work closely with a healthcare provider to determine the most appropriate treatment approach for bipolar disorder. Medication alone is not sufficient for managing bipolar disorder, and a multimodal treatment plan that incorporates therapy, support groups, and lifestyle modifications is typically recommended for optimal outcomes. Remember, bipolar disorder is a complex condition, and finding the right treatment approach may require some trial and error. It is important to be patient, communicate openly with healthcare providers, and actively participate in the treatment process. With the right support and a comprehensive treatment plan, individuals with bipolar disorder can lead fulfilling and productive lives.